Hi, I'm Virginia Madrid, and this is going to be Antepartum Assessment. The purpose of doing an antepartum assessment is to find any abnormals during the pregnancy. We want to try to prevent any complications, and we want the best outcomes for mother and for baby once the baby is born. So there are different intervals that we need to see our patients in the antepartum period, and depending on their risks will depend on how frequent they need to come in for their visits. So normal vital signs for our patient during pregnancy. Most of them are going to be pretty standard or pretty normal for what their pre-pregnancy is. For temperature, it can be anywhere from 97 to 99 will be normal, and we usually take that orally. We can take it tympanic or we can take it temporal, depending on what we have available at the facility. For respirations, later on in the pregnancy, they start to increase, so it can be anywhere from 20 to 24 can be normal, and stuffiness during pregnancy can be normal as well. So those are some of the normal deviations. Blood pressures should be pretty close to normal. That is one of the things that we watch pretty closely. We are looking for any changes more than 15 in systolic or diastolic. Anything like that, or anything over 140, over 90 or higher is going to be looked at a little bit closer. If we do find deviations from normal, we're going to make sure that we do more frequent assessments, and that we're going to look at some other information along with that in our assessment to determine whether or not the patient may be going into gestational hypertension or into preeclampsia. Normal weight gain in our patient that is pregnant is going to be between 25 and 35 pounds. It's going to be on average. For caloric intake, we want to make sure that our patient takes in 330 calories per fetus per day, extra beyond what her normal calorie intake is going to be based on her BMI. There are other factors that can determine weight gain. If we have a patient that's underweight, then we're going to require that she gains a little bit more weight than normal. And if we have a patient that's overweight, she may not need to gain the 25 to 35 pounds that they would if they are a normal weight. So we have to determine the BMI from the first visit during the pregnancy. In addition to normal weight gain, if we see a quick or rapid weight gain with 1 to 2 pounds in a day, it's usually a fluid weight shift, and that can be a sign of preeclampsia. So we definitely want you to report anything like that when you're at home, if you're on the scale from day to day. Always do hand hygiene, either by washing your hands or using the hand sanitizer. Since I haven't soiled my hands, I'm going to go ahead and use that hand sanitizer. So, good morning. Hi.
Hello.
My name is Virginia. I'm going to be your nurse today. Can you go ahead and state your name for me?
Susan Smith.
Susan Smith. And what is your date of birth?
April 1st, XX.
Okay, all right. So just making sure that your bracelet matches up with your name and your date of birth. And you also have an MR number on here, which is your medical record number, but I don't expect you to know that, so that's okay. So today you're in here for your visit, and this is antepartum being that you're still pregnant. I know you're ready to have this baby, but you're still pregnant for now. So I want to go through antepartum assessment with you, okay? If you have questions at any time, I want you to let me know. I want to ask you a few questions also. Do you know your estimated date of confinement or your due date? Did they let you know?
Well, I think I'm due right before Halloween.
Okay, right before Halloween. Okay. So we'll go ahead and put October 29th. That makes 40 weeks. 40 weeks is your pregnancy. Okay. So then that would make your estimated date of conception or your last menstrual period the 22nd of January. Does that sound correct?
That's right.
Okay, perfect. There's another way we can also estimate your due date by using what we call Nagel's rule. And what Nagel's rule does is we take the last menstrual period, we subtract 3 months from that, and then we add 7 days. And that'll also give us the same thing that I found with the OB wheel that showed us the same information. So that's just another way that we can do your estimated due date. So with antepartum assessment, it's really important to get a good history for you. So I'm going to ask you a couple of questions before I get started with the physical interview, okay? So let's go ahead and
Okay.
let me know if you have any allergies whatsoever. Do you
Yes,
know?
I'm allergic to shrimp.
To shrimp, okay. Any other allergies besides shrimp?
No, that's the only one.
That's it. And what happens when you eat shrimp?
Oh, I break out in bumps all over and I get itchy.
Okay. Any problems with breathing when that happens?
My tongue gets swollen.
Okay. So you have a lot of different reactions to that. Perfect. When was the first time that happened to you?
Oh, I was a little kid.
Okay, so it's been for a lot of years. Okay, and you are banded for allergy, so I'll make sure to note that on the chart that I'm going to take for you as well. Okay, thank you for letting me know that. Ms. Smith, I'm going to go ahead and take your temperature. Okay, if you could
Okay.
just place this under your tongue. Okay, thank you. Okay, your temperature was 98.5. That's perfectly normal. How have you been feeling?
Great.
Okay, so you haven't been ill at all or anything since your last visit?
No, I'm ready to have this baby.
Great, I know. It gets exciting when you get towards that, doesn't it? Okay, so another thing I'm going to go ahead and do is take your other vital signs. So we took your temperature, that was normal. I'm going to go ahead and listen to your heart rate, okay? So I'm going to just lower your gown. Okay. Sorry, my stethoscope's a little bit cold. Okay, so your heart rate is 80. What is it normally?
I think that's normal for me.
That's normal for you? Okay. And 80 is within parameters of being normal also for antepartum. Usually it goes up about 10 beats while you're pregnant. So maybe your normal might be around 70 or maybe upper 60s. Okay, and that's completely normal. Okay, so I want to go ahead and I'm going to go ahead and check your pulse over here on your wrist also, just to make sure that it's about the same, okay? And I got 77, so that's pretty close to the other one. Let me go ahead and do your blood pressure as well, and then I'll ask you some questions about what your normal blood pressure is as well, okay? Okay, I got 118/65. What was it pre-pregnancy? Do you remember?
I think it's about that.
About the same? Okay, so no big changes with that. That's good. The reason that we monitor that so closely is one of the major complications in pregnancy can be gestational hypertension, and that can go into preeclampsia and eclampsia. And we definitely want to catch that early on. So if we have major or significant changes from what your baseline or your pre-pregnancy rate is, we have to really note that, and then we've got to monitor it pretty closely. But your pregnancy has been going along very normally, so I don't expect any of those major changes at this point, but we still got to be checking, okay? All right, and then the last thing I'm going to do is your respiratory rate, okay? So with that, I'm going to watch your chest rise and fall, and I'm going to see how many times per minute that you're breathing, okay? So just breathe normally, okay? I got 20 breaths per minute, okay? All right, and that's pretty normal as well. Have you noticed that it's a little bit harder for you to breathe during pregnancy?
Yeah, when I go to sleep at night, it feels like the baby's pressing up on my chest, and sometimes I breathe faster.
Oh, yes. So you notice that you breathe a little bit more quickly? Okay, and that can be normal as well, because that uterus is growing, and with the weight of that, it can really compress all of the organs that are up in your upper chest as well beside your abdomen. So that's very, very normal. How about stuffiness or anything like that? Are you able to breathe through your nose okay?
Yes, I get some nasal congestion, especially at night.
Okay. Are you using anything for that?
I just have some of that saline mist to spray up your nose.
Oh, okay, perfect. Perfect. So just the over-the-counter one, just that has just saline, and that helps? Does that relieve your congestion? Great. Okay, great. So we're going to go ahead and move on to the rest of the assessment. So we took your weight on the scale before you got into bed here, and I noticed your weight was 150. And your last visit, it didn't calculate what you were. Can you let me know how much you weighed on your last visit 2 weeks ago?
Well, I've gained 25 pounds my whole pregnancy.
Okay, so that's pretty right on track. What was your normal weight before you got pregnant? Do you remember?
About 125.
About 125. Okay, so our finding of 151 today is pretty accurate. So you're right at 26 pounds at this point. So that's great. That's good. That's normal. As long as you're within the 25 to 35 pounds during the pregnancy, that's good because you were a normal weight coming into your pregnancy. So that's perfect. Okay, thank you. Now I'm going to complete your head to toe assessment, or what we call a physical assessment, and I'm going to be looking at specific things, changes during pregnancy and otherwise. So generally I like to look at your skin just walking in the door. So I'm looking at what is your normal color for ethnicity. So I notice you have a pinkish tint to your skin. That's perfectly normal. And I want to look at some other things also with your skin. So I look for bruising. Do I notice any bruising throughout your skin? Easy bruising, anything like that. I would also want to look at to see if you have the mask of pregnancy, which we call melasma, okay? And what that is, just kind of a darkening and a thickening of the skin in the facial area. I can also look to see if I notice anything else abnormal on the skin. One thing that's completely normal during pregnancy, and I'm going to go ahead and look at your abdomen, okay? And so with your abdomen, what I'm looking for is striae gravidarum, and with that, it's, in other words, stretch marks, okay? Have you noticed any of those during your pregnancy?
Oh yes, I have some.
Okay, so it's normal to have them, and I'm sorry, I'm going to lift this up to look at the breasts also, okay? So with the breasts, you can also have some striae with the stretching as the breasts grow, and I'm going to go ahead and cover that. On the abdomen as well, and yes, I do notice that, and that's just from the quick stretching of the skin based on the pregnancy, okay? And depending on your ethnicity, sometimes they're kind of flat and maybe very light, pale, and they'll fade with time. And then some types of skin will get a little bit thicker, and they may not heal or go as flat, and it really depends from person to person. Okay, so I notice you have them here on the hips and on the abdomen, and that's completely normal. Okay, perfect. And then I notice also you have the linea nigra, and that goes along the abdomen, and that's just a darkening of the skin along that area, and that's completely normal in pregnancy as well. So I do see you have that also. Now I want to kind of look at head to toe also. So your hair distribution, your hair looks nice and shiny. Have you been losing some? Have you noticed?
No, I don't think so.
Not too much, good. So you're eating a healthy diet, probably well-rounded, because your hair looks nice and shiny. Another thing we can look at with that is also the nails. Okay, are your nails growing fast?
Yes, I think they're normal.
They look pretty healthy. So one of the things that helps with that is our prenatal vitamins. The prenatal vitamins have everything we need, and they can help build the hair and also the nails as well, besides supplementing what we need nutritiously for our pregnancy. Okay, so that's completely normal. Also want to look at your eye. They look nice and clear. Can you just turn your head towards me? Okay. They're nice and symmetric. Okay. So how about your nose? Have you noticed any stuffiness, bloody noses, anything like that?
I had bloody noses when I was first pregnant, but they went
Okay,
away, and now I
perfect.
just have some stuffiness at night. when I eat.
Right. Okay. And you said you were using the saline for that, and that's correct.
Yes, it helps. a lot.
Perfect. Great. Okay. So I can look at your throat too, make sure everything looks aligned and normal. Any problems swallowing or anything like that?
No.
No? Okay, great. So I'm also going to look at your teeth. Okay, if you can say off for me. Okay, perfect. So what I'm looking at is the mucosa, making sure it's nice and pink. You don't have any oral problems that I notice. Okay, the teeth look aligned, and it looks like you have all your teeth, so you haven't had any problems with loose teeth, bleeding gums during the pregnancy or anything like that?
No.
Okay, great. So that looks completely normal, okay? So I'm gonna go ahead and move down to your chest. I'm gonna go ahead and listen to your lung sounds, okay? And so just take nice deep breaths when we're doing that, okay? And I always wanna go side to side, and I'm gonna listen anterior and posterior, okay? And what I'm looking at is to make sure that they're equal and clear, okay? So I would do that for each one, and I always want to make sure that I'm comparing one side to the other. Okay, and you're nice and clear, so that's great. The other thing I want to do is I'm going to go ahead and look at your abdomen, and I want to look at it before I do anything with it. And then I already listened to your heart when I took your pulse, okay? And it sounded nice. So I heard S1 and S2, that's completely normal. Sometimes in pregnancy, we can have a little bit of a murmur, okay? Sometimes it can be from anemia, but it's also increased turbulence from the pregnancy. So if I heard that, it wouldn't be completely abnormal either, but I would want to make sure if I noticed, and I didn't notice that with you at all, okay? Do you have a history of anemia or anything like that?
No.
Nothing? Great. Okay, so once I listen to all of that, I'm going to go ahead and I want to look at your breasts, okay? Do you mind if I look at your breasts? Would that be okay?
No, it's okay.
Great, okay. So what I'm going to do is just look at them. What I'm looking for is symmetry for one. Do you do self-breast exams when you're not pregnant?
Yes, every month.
Perfect, great. So anytime you would find something abnormal, you want your physician to check that in between your annual breast exams, okay? So I'm looking to make sure your nipples are everted, okay, and they're nice and everted. Are you planning on breastfeeding?
Yes, I want to breastfeed.
Perfect. And this is your first pregnancy, right?
This is my first baby, and it's a girl.
And it's a girl. How exciting. So hopefully you already got some names picked out. So I'm just looking to see they are nice and everted. Have you noticed, are you able to get any colostrum or anything like that yet?
No, I haven't tried.
Nothing. Okay. So after you deliver, that colostrum should start coming in. Sometimes you may see a little bit of leakage prior, but if not, that's okay. Sometimes it takes a little bit to get that. Okay, so I'm just looking, all right, and I don't see colostrum or anything. And the nipples look nice and intact. No cuts, no bruising, nothing. And then I'm just gonna palpate up here, okay? And they don't feel like you're feeling or anything. Have you noticed any enlargement during the pregnancy?
Oh yes, I'm an extra size bigger.
You are? Wow. So you've noticed a lot of breast changes, I'm sure. Very important to wear a good support bra, okay, during pregnancy and even during postpartum. So make sure, don't wear anything with an underwire because that can affect the milk ducts and that can cause problems after delivery as well. So be careful about that. But something nice and supportive, especially as your breasts start to fill, they'll get nice and heavy and you don't want to hurt your back for one and you want to support those breasts, okay? So that's going to be really important. All right, let me go ahead and go to your abdomen. Okay, and I always like to look first, okay, and that's just looking at the shape of the abdomen, if I notice any pulsations or anything different. And during pregnancy, I'm sure you see, sometimes you see an area that kind of starts moving on its own, and that's probably your baby, so that's completely normal, okay. Looks like baby's probably sleeping right now though, so I'm going to go ahead and I want to listen to your bowel sounds, okay. So I listen to your bowel sounds, all right. Sometimes during pregnancy can be a little bit harder to hear because you have other extra sounds in there right now, okay? So I'm just listening to make sure they're active. Okay, are you hungry? I hear them rumbling.
I'm hungry all the time.
Okay. They're nice and active. And the reason I like to auscultate or listen first is because once I start manipulating, it can change the sounds, okay? So I gotta make sure I listen before I do anything else, okay? So now, before I do anything else, I wanna go ahead and measure what we call your fundal height. So I'm gonna lower your bed if that's okay, all right?
Okay.
And then I'm gonna take the measuring tape and I'm gonna measure. And what I'm gonna do is I measure in centimeters from your symphysis pubis, okay, to the top of your fundus, which is the very top. So I'm measuring in centimeters, and it should match up plus or minus 2 to the weeks of gestation. Okay. Let's see. So, measuring right at 38 weeks. Okay, and you're how many weeks pregnant?
38 today.
38, perfect. So during pregnancy, once you hit about 20 weeks, it should be a centimeter is going to equal a week gestation. And so if you're 38 weeks, 38 centimeters is perfectly normal. And it can also be plus or minus 2 weeks. Either way is normal. And then your baby's gonna start moving down. Have you noticed any changes in your abdomen at all?
No, she hasn't dropped yet.
She hasn't yet, so that's why she's still at 38. Because once you get closer, sometimes it doesn't always measure the same anymore because the baby does start to drop and move into that pelvis. Okay, so now we're here at the fun part. The fun part is going to be listening to your baby's heart sounds. Kind of sounds like a horse galloping, right? Okay, so I've got some cold gel. I tried to warm it up a little bit in the warmer, but it still feels not quite as warm as I'd like. So it might be a little shocking. Okay, so I'm going to go ahead and listen. Where do you usually hear the baby's heartbeat when you're in? Do you remember? Where's your baby usually laying? We could do Leopold's maneuver, which is going to tell us where the baby is at, okay? And in that, what we do is look at what you have here in the fundus. We're gonna look at what we feel on the sides, if we have nice, soft. And so we're gonna palpate that side. Okay.
The doctor said the baby's head is down.
Okay. So over here, it feels like some soft, squishy parts. Okay, so that's probably hands and feet. Okay, and baby's head's here. So I'm trying to feel for the firm part. Okay, because that's where we want to place it. All right, so it feels like here. All right, so I'm going to go ahead. Sorry, it's cold. All right, so we're going to listen to the baby's heartbeat. All right, so we're right at 150. So between 110 and 160 is normal, so 150 is perfectly normal for your baby. Do you remember what they usually get for that?
I think the last time it was about 140.
About 140. Okay, so that's pretty close. I'll wipe all this gel off of you.
That's too fast for me to count.
I know, it is fast. It's double what yours is. Remember, yours was close to 80? So it's double what yours is. Okay. So go ahead and put that back. Sometimes when we actually listen to the baby likes to move. So sometimes we kind of have to chase that baby with the monitor or the Doppler in order to hear the baby. But your baby's heart sounds good. Okay? Are you doing your fetal kick counts?
Yes.
Yes. So remember with the fetal kick counts, we want you to do that every day. At a time when you can relax and you can really pay attention to what baby's doing, because it's kind of hard to pay attention when you're out moving around and staying busy. So at least once a day, I would say in the evening, probably when you're getting ready to relax, to kind of lay down, and I want you to feel for at least 10 movements of your baby. We give you up to 2 hours. We try to get you to get the 10 in 1 hour, and you want to do it when baby's active, and usually when you're laying down and you're trying to rest is when baby wants to wake up, right? So you know your baby's active times. If in the first hour you don't get the 10 movements, you can get up, walk around a little bit, eat or drink something, and that sugar usually gets baby moving as well. So that's another thing that you can do that gets baby active. But if you get the 10 movements in that first hour, perfect, then you're done. But we want you to keep a record of that every day. Okay, once you start feeling baby moving in pregnancy, and usually for first-time moms, it can be 18, 19 weeks. If you've already had pregnancies before, you may feel it a little bit sooner. And it usually starts with what we call quickening, which is kind of like a butterfly feeling. Sometimes people think it's gas or something like that. But once you start really feeling that baby moving, you should feel that baby moving pretty regularly. If there's ever a point in time where you don't feel the baby moving, normally, you need to let your physician know or come into triage here and let us know, and we can always check the baby. We can use the Doppler, listen to baby's heartbeat. Does that make sense? Do you have any questions about that?
Yeah.
And the importance of letting us know? Great.
Okay.
Okay, great. I'm gonna go ahead and sit you back up, and I wanna ask you a few questions, and then I'm gonna go ahead and look at other areas. So any problems with urination? Are you able
It
to
seems
go
like
right?
I pee all the time now.
It does, doesn't it? That's because that heavy, what we call gravid uterus, is putting pressure on that bladder. So it feels like you need to go. Even though you have more of a capacity to hold more urine, you're diuresing and you're getting rid of fluids because you also got that baby. So you're cleaning for two, right? So with that, you're gonna urinate more. And are you drinking a lot of water?
I drink probably 8 glasses at least a day.
Okay, definitely wanna do at least that much, okay? Are you drinking anything besides water, or is that your main drink?
Sometimes I drink a coffee.
Okay, you wanna be careful about caffeine, or are you drinking decaffeinated?
Yeah, I drink decaffeinated.
Good, because they do want you to limit the amount of caffeine during pregnancy as well, because it is a stimulant, and we don't really want you to have too much of that during pregnancy. But you gotta have a little bit, right? So just be cautious with that. So with the frequent urination, that's completely normal. Do you notice any strong odor, burning with urination, anything like that?
No.
Okay, great. Those would be signs that you could possibly have an infection. So if it burns when you urinate, if it looks cloudy or has a strong odor, let us know right away so we can test you. And I know when you came in, we asked you for that urine sample, and we've been doing that all along. And so you did your clean catch, and with your clean catch, you have to make sure that you wipe the perineal area prior to urinating. We want you to urinate a little bit, get rid of that, and then urinate in the cup after that, and then go ahead and close it. And then we gave you that label and everything on there. And then we also do the strip test for that, and we're looking for glucose, white blood cells, protein, anything like that that may indicate that something abnormal is going on in a pregnancy. So that's very important to do as well. And we didn't notice any white blood cells, we didn't notice any glucose, and we didn't notice any protein. Any of those could be indicators that something is going on. If we see glucose in the urine, it could mean that you're having some diabetes going on in pregnancy, which we tested for at 24 weeks, and all of your values were normal. If they were abnormal, we would check you a little bit closer as well. Okay, and then protein, we look for protein in the urine for preeclampsia. If we notice that protein is starting to spill into the urine, then we have to do more testing, and that also goes along with the blood pressures. Okay, other things we would ask you if we did see protein in the urine, or we did find that your levels, your blood pressure levels were high or abnormal, then we would have to do further testing. We could do what we call a 24-hour urine collection, and in that, and we have to keep the urine on ice, and that is to check for protein in that 24-hour period to make sure that you didn't have protein spillage also that could indicate preeclampsia. Okay, some other questions I would want to ask you, and we ask you each time you come in, is if you've had any headaches.
No.
No. Some headaches can be normal if it goes away on its own pretty quickly, if it's mild, or if you're taking Tylenol, as the doctor told you that was okay to take later on in pregnancy, if it didn't go away with that, or if it came along with any visual changes, blurriness, spots, anything like that. Any epigastric
No.
pain?
No, I'm
None?
having problems with my vision.
Great. If you had epigastric pain, we'd also be concerned because that could be leading into preeclampsia or into what we call HELP syndrome. So we always want to monitor for that each visit as well. Some other things I want to ask you too, we asked you about the burning with urination or anything like that. I also want to ask you if you have any leakage of fluid from your vagina. Have you noticed anything like that?
No.
No. If you did, we would want you to let us know, because that could mean that the amniotic sac is either leaking or that it's ruptured. Okay, either one. And if that happens, we want you to come in and get checked right away. okay? Within 24 hours, we would need to make sure it either resealed or that you delivered, because you have a higher risk for infections that go along with that, okay? And if the baby's head's not engaged and we have a rupture, we could have what we call a cord prolapse, or that the baby's cord comes through the vagina. If that happened, it could cause major problems also with your delivery and with your baby. So we always want to check that. How about bleeding? Any vaginal bleeding that you noticed?
No bleeding.
Great. Okay. So we always look for vaginal bleeding, leakage of fluid, anything like that. And you said none of that's happening, right? Great. So
No.
other things that can happen during pregnancy is that you could get some varicose veins and some other types of spider nevi, what we call in the legs. So I'm going to go ahead and check those as well. Okay. I'm also going to check your pulses and your capillary refill. We checked it in your nails, and it was very brisk, less than 3 seconds, and that's perfect. That's what we want. Okay. So we're going to make sure you're covered down here. The other thing I want to check is your reflexes. Okay. So we can check your reflexes in your arms, and we can also check your popliteal, which is down here. The main thing with checking reflexes is that we got to make sure that we support the joint. Okay, so I'm going to go ahead and support the joint. Make sure that you're reflex. Okay. Yeah, I know that feels funny, right? Okay, but that was perfectly normal.
Yeah, my leg jumped.
It did. So I'm going to go ahead and do that on the other side as well. There can also be something that we check with preeclampsia, or if we give medications like magnesium sulfate during pregnancy, in case somebody were to have high blood pressure, we were worried about seizures, and we would use that medication. It can slow down the respirations. It can also slow down all of your reflexes. So we always check that during use of that, and during pregnancy to check for the preeclampsia. So I'm going to feel for your pulses, okay? And I do like to do them at the same time because I'm comparing and making sure that they're equal, okay? All right. Okay, so they're equal. All right, perfect. So now I want to go ahead and I want to look at your capillary refill on your toes as well. So it's brisk. What that means is it's less than 3 seconds, so that means the circulation to your legs is good, so that's great. The other thing we like to look for, and I'm not going to put too much pressure on the back of the leg, but you're at high risk for blood clots during pregnancy, and then also in your 6 weeks postpartum period. And some people are at higher risk than others. But I'm going to go ahead and just look, and what I'm looking for is color of the skin. Okay, it's nice and pink on both sides. They look even. Okay, we can also measure them if we were worried about swelling. You don't have any edema at all. Some edema in pregnancy is normal. Okay, so we would want to look for that, but you don't have any at all. So that's good. Okay, all right. And then I like to look, make sure, like I said, they're equal. Feel the temperature. Okay, and I'm not massaging or anything, because if there was a blood clot, I could release it doing that. And I'm not doing Holman's sign either. So I'm just palpating gently to feel for warmth and to feel if there's any tenderness. Do you notice any tenderness in the legs?
No, it doesn't hurt.
Great. Okay, so everything looks perfectly normal down here. Have you noticed any change in balance during pregnancy?
My husband says I walk like a duck.
Yes, that waddling gait. Okay, another thing that can be normal, that's normal during pregnancy. You just want to be careful about losing balance, because our balance does shift with that gravid uterus also. Okay, so just be cautious with that. All right. Are you doing any exercising?
I walk every day.
Great. So just make sure to stay hydrated if you're out in the sun, because it gets pretty hot, and we want to make sure that you don't have any issues with dehydration. If you get dehydrated during pregnancy, it can lead to contractions, and we definitely don't want any preterm labor. So if you notice that happening, you got to make sure that you hydrate and try to rest. If the contractions don't go away, you got to call or come right in, okay, to get checked, either to your physician's office or to us here in triage, okay? So we're going to make sure that you have that number before you leave today, all right? The other things, I want to go ahead and go over your record with you. So I know we use a lot of terminology you're probably not familiar with, especially this being your first baby. And first baby means that you're prima gravida. Prima gravida means first pregnancy, because gravida means pregnancy, right? Okay, so with that, I want to go ahead and go through your record with you, if that's okay. Now that we've done our physical assessment. Okay, so I'm going to go ahead and go through this, and you tell me anything that's different. So, prenatal record, first pregnancy. So you started your first visit at 7 weeks pregnant, is that correct?
Yes.
Perfect. So that means you were in your first trimester. And first trimester, we like to get you in early, and we stated one of our objectives was to find anything that was abnormal. So if you're coming in early, we can find something quicker so we can make sure that both you and your fetus have good outcomes. So that's really important to do that, okay? So at 1 to 4 weeks gestation, we had enlargement of the anterior posterior diameter, and that's normal. Okay, we had at 4 to 6 weeks, we had good L sign, which is the softening of the cervix. That's completely normal in pregnancy. Okay, the vagina went from pink to dark pink. Okay, and your discharge increased a little bit at that point. Is that correct?
Yes.
Okay, so at 8 to 12 weeks, we had a bluish discoloration of the vagina and the cervix, and that's completely normal. Okay, that's called Chadwick's. And then the pelvic measurements are done at that time because we want to make sure that we think the baby will be able to fit within the pelvis, because there are different shapes to the pelvis, and we want to make sure the baby fits in that inlet okay. If not, we would have to make sure to plan ahead for something like a cesarean section in case the pelvis wasn't in a shape that could deliver a baby vaginally. So it's just something we look at earlier. Hemorrhoids during pregnancy can be completely normal. Sometimes we get a little bit more constipated, and we have a lot of gastrointestinal changes. So with that, did you have any problems with that throughout the pregnancy so far that you've noticed?
Yes, I have some constipation.
Okay. What are you doing to treat it?
I just have higher fiber in my diet and more food.
Great. And those things can help too. And also ambulation or walking can also help with that as well. So you want to just make sure you prevent that, because that can increase your risk for hemorrhoids. And hemorrhoids, you may notice if you have a little bit of bright blood when you have a stool that's a little bit harder, you may notice that you have a little bit of that. So you would want to let us know. But that is a normal finding in pregnancy. Another thing that we see a change in, and I did see it in your record also, is an increase in your white blood cells. Okay, 5,000 to 12,000 is normal in pregnancy. Okay, that's completely normal. Another thing that happens is you have a decreased hematocrit. Okay, and the hemoglobin can drop a little bit too during pregnancy, and what we call that is hemodilution. Okay, so you have an increased volume, but you have decreased RBCs, hemoglobin, hematocrit numbers, but you are having circulation for 2. Another thing you can notice is that you can have hypotension if you get up real quick. So I'm sure you've noticed that you got to get up a little bit slower and sometimes sit on the side of the bed a little bit before you start ambulating. So that's normal.
Yes, I get dizzy sometimes.
You do. So do you just wait a little bit and it passes on its own?
Yeah, it goes away.
Perfect. That's what we want to hear. Okay. All right. So medical history, you didn't have any previous surgeries, you didn't have any previous health problems, no problems with thyroid, no GI problems. Those are all things we would want to ask about. Okay. Previous OB history, you said this is your first pregnancy, so you haven't had any abortions, either spontaneous or induced? No. Okay. That's another thing we would want to know, because that might show you an increased risk also. Current pregnancy history, you're not having any trouble with that at all. Okay. Also, in looking at your blood type, so you're O positive, right? Okay. We also looked early on at a few infections that can be a problem during pregnancy. Okay, so we also looked at if you were rubella immune. And the reason we look at that is because we cannot vaccinate for it during pregnancy, but we would want to look at risk factors for that. You don't want to get rubella during pregnancy. And the reason we can't give you that during pregnancy is because it's a live vaccine, and we don't give any live vaccines during pregnancy. Okay? We didn't look
I
at...
had a flu shot.
That's great. That'll help protect you from flu during the flu season, which is great. And that can be really rampant at times, so I'm glad to hear that you got that. So you did have, it shows that you had a tetanus shot last year. Is that correct?
Yes.
Okay, great. So if not, we would want to catch you up on those vaccinations. We can give you what we call Tdap, but we give it to you in the second or third trimester. We don't give it to you early on in pregnancy. Everything is forming in that first trimester. So we want to make sure that you were taking your folic acid, your prenatal vitamins, and even before you get pregnant to help protect against neural tube defects. So that's going to be really important for future pregnancies as well. Okay? All right. So rubella immune, we looked at for HIV early on, and then we double checked again in your last trimester, and they were both negative. We also looked at hepatitis B, and you were negative. Okay. Early on, we did a pap smear, and that was normal, and we look at that during pregnancy. Screening needs to continue on that during pregnancy. So we do it on the first visit, and since you were here early, we went ahead and did it at that time. So that's normal. Okay. We looked for gonorrhea and chlamydia as well. They were both negative. The reason those are so important is because any sexually transmitted infection during a pregnancy can cause problems with your baby. Okay, can cause infection, can cause intrauterine growth restriction where the baby's not growing normally, or even preterm labor. So that's important. You don't have any history of herpes. Okay, we also look for syphilis with the RPR, and that was in the first visit, and then we also looked when we looked at HIV again in the last trimester, and those were both negative, and that's great. If you did end up with an infection during pregnancy, we would have to treat it. And we just have to make sure that the antibiotics that are ordered are okay during pregnancy, because a lot of medications can cross the placenta. And then also, again, when you're breastfeeding, we also want to make sure all the medications you take are safe also. So that's going to be important as well. Okay. All right, and then we've looked at your growth for each visit that you come in, and we also measure your weight to make sure you're staying within that 25 to 35 pound normal range, and then ask you all those pertinent questions. If you're having contractions, if you're having pain, the headaches, visual changes, epigastric pain, anything like that that could indicate that there's a problem during your pregnancy. And then we always take your vitals for each visit as well, like we did when we first had you come in. Okay. Do you have any questions about anything that we've done with our visit today, or anything that's left out of the history that you would want to add?
I'm just ready to have this baby.
I know. So hopefully one more week. The doctor's going to come in and check you to see if you have any cervical changes. Okay, since you're not noticing any leakage of fluid or anything like that, or contractions that you've had. Have you had any Braxton Hicks contractions? Do you remember what those are?
Yes, I feel those in the upper part of my stomach.
Right, and they're in the front, right? Is that
Yeah,
correct?
only in the front.
Okay, and that's normal. And what it feels like, it's just tightening and then softening, right?
Yeah.
Okay, so how we know the difference between like a true labor and a non-true labor is that there's cervical changes. And if you're just feeling it in the front and you still haven't started leaking fluid, then those are probably Braxton Hicks. Are they painful, or they just feel funny?
They go away when I take a walk.
Perfect. If they would progress when you're walking, then it can be a sign that true labor is starting as well. Because usually with walking, if true labor will start to intensify or start to become more active. Okay, any questions about anything that we've covered? Or anything that you need to report to your physician? Okay, great. Well, thank you for coming in to visit us today. So we'll see you next week.
Okay, maybe Priscilla will be here.
I hope so. Other assessments that are important to do when your patient is visiting, of course you want to establish a rapport with your patient for each visit. You want to be consistent in the questions that you ask and the physical assessment that you do. And we cannot assume because we asked one time about abuse that no abuse is occurring. Things can change, circumstances change for patients throughout, and pregnancy is a stressful predicament, and it can be for the patient as well as the whole family. So you want to make sure that you screen for abuse for each encounter, not just the first visit that the patient ever comes into the office. So with each encounter, you want to ask that. You also want to look for signs of abuse when you're doing your physical assessment and you're looking at the skin. So besides we're looking at bruising that can occur, from patient injuring themselves, you also want to look at bruises that can occur in areas that the patient would normally do it, like on the back of the arms, things where you're not going to just trip and bump, or that you would bump into something. So you have to look at that. And if you do find those types of injuries, you would want to clarify, how did that injury occur? Do you remember how it occurred? And let them give you a description of what happens with that. Abuse can increase during pregnancy, like I said, because of the stressful situation. You also want to look at the psychological assessment of your patient when they come in each visit. How do they feel about the pregnancy? Are they apprehensive? Are they excited? Are they feeling that they don't really want this baby? You want to look at all of those things. You're looking at risks for the patient during the pregnancy, but also in follow-up in the postpartum period. If it's an unwanted pregnancy, you're going to be at higher risk for abuse of that infant also. So you want to make sure that the patient, as far as screening for drugs and alcohol as well, illegal and legal drugs. Sometimes patients can abuse over-the-counter medications. They can abuse things that they've gotten prescriptions for or that are not their prescriptions, but you always want to ask those questions as well. You're looking for that. Suicide screening, you want to ask that on every encounter as well. Is the patient high risk for suicide? Are they at high risk for depression? If they're already having a history of depression during pregnancy, that can exacerbate as well. So you want to double check those types of things as well. It is normal for the patient to feel a little apprehensive at times because they do get a little bit overwhelmed in the thought of the delivery being painful, or maybe not being prepared financially or physically in the home. So you want to make sure that you also access their need for resources. What resources do they have? What resources do they need? And in planning, if they need more assistance with mental health, you would want to talk to the patient about that as well. But each visit you want to screen for each and every type of risk factor. And that includes all the psychological things we just mentioned. Cultural assessment is always important, especially living in a large city. You're going to have patients from all over the country and other countries as well. So you want to make sure that you always give cultural respect. You want to develop a positive rapport, and you do that with all patients. You want them to trust you, and you want to establish for them to be able to share with you anything they have concerns about, and to be open and honest so that we can provide the best care possible. Have empathy for patients when they're seeking advice. Don't judge, okay? Everybody has a different lifestyle, have different behaviors, and you want to make sure that you respect that. It doesn't have to agree with your lifestyle or anything that you're doing, but you've got to be respectful for your patient. The S is for support. You want to make sure you involve the family and significant others. Sometimes it can be male-female, it can be female-female, it could be an adoption that's going to go through. It can be a lot of different things. So make sure you assess for that. Even if they're giving a patient up for adoption, you want to provide support. That's not always the easiest thing. They may realize it's the best thing for their baby at that time, but they may have a hard time with that. So make sure you're being supportive in that and answer their questions as well. Partner with your patients, okay? You're there for the same goal. You want a healthy outcome for mom and for baby. So it's very important to make sure that you partner with them in everything you do. Explain or teach everything to the patient. Don't assume they know. Even if it's their second or third pregnancy, they may not have learned from the last pregnancy certain things. And I find that with each patient encounter, I never assume that they already know what I'm about to teach. I try to just teach. And if they understand what I'm saying with a brief explanation, I can leave it at that. If they don't, then I'm going to make sure that I clarify or add more information until they understand, and they can even verbalize it back to me in their own words. Cultural competency, respecting the patient's beliefs. So that's always important. Whether, like I said, it's something you agree with or you don't, you got to be respectful. T is for trust. Trust is essential when taking care of your patient. They're not going to be open and honest with you or share information if they don't feel that they can trust you. So that needs to be established early on in the visit. Psychological changes we kind of mentioned already. So excitement, apprehension, and ambivalence can be normal during pregnancy. You want to make sure as they get closer to the delivery that they're ready. Okay, so in that is preparation. We always feel more comfortable and confident with the more information that we have. So make sure that the patient is clear on what's correct, what's incorrect. So we don't want them Googling information or looking at Wikipedia. So let them know what resources are okay, and to make sure that they feel comfortable to ask questions to the provider and to the nurse for each visit. Make sure their living situation. What kind of home do they live in? Do they have clean running water? Sometimes our patients may live in colonias or areas where clean running water is not a commodity that they have regularly. So in that case, you would want to screen, making sure that they may be using bottled water, that they're boiling water before they use it for cooking or anything like that. That they know meal preparation, how food can sit out or not sit out, what needs to be refrigerated, how long can you keep something. Making sure about hand washing and disease prevention, making sure that they're covering their cough, washing their hand, checking for up-to-date immunizations on the first visit, and screening throughout what's appropriate depending on their gestational age as well. Those are all important. And then influenza. If we're in the time of influenza, we want to screen the patient and make sure that they get the appropriate vaccination if it's